Hello everyone. Welcome to our new volunteer orientation. My name is Sarah Grocke, and I am the Community Engagement Manager for Nevada Cancer Coalition. We would first like to thank you for your interest in coming out to volunteer with us. This presentation is meant to explain the history of Nevada Cancer Coalition, what we do here at NCC, and also explain the different types of volunteer opportunities that we have to offer and how you can register to sign up to volunteer with us. Let's go ahead and get started with the presentation. So first off, what is Nevada Cancer Coalition? We are a comprehensive cancer control coalition, a group of individuals who represent diverse organizations and areas of cancer working together, pooling resources, and coordinating efforts to increase the prevention of cancer and reduce the burden of the disease. We serve as Nevada's leading resource for comprehensive cancer control. We support healthcare professionals with continuing education opportunities, resources, and patient education tools. We collaborate with regional, state, and national partners to develop evidence-based projects and programs. We provide outreach for and access to cancer prevention and screening resources. And lastly, we advocate for policies to improve access to healthcare for all. NCC was created in 2002 as the Nevada Cancer Council to develop the state's first cancer plan. We've grown over the years from an all-volunteer effort to a 501c3 nonprofit with staff in Reno and Las Vegas. Our work has evolved beyond development of the cancer plan to include programs and initiatives in prevention, early detection, and survivorship. We also offer continuing education and training opportunities, host outreach events, spearhead awareness campaigns, and distribute educational materials. Our policy efforts have resulted in positive change in our schools, clinical facilities, and communities. Our values include collaboration, partnership, science, research, innovation, compassion for others, and advocacy. So, how do we accomplish our goals? Firstly, cancer control efforts in Nevada are guided by the Nevada Cancer Plan, a 5-year strategic plan developed by the coalition members, stakeholders across the state. It serves as a statewide roadmap for goals, objectives, and activities to reduce the burden of cancer. Secondly, we work toward the coalition's goals through active participatory committees. We call them task force and collaboratives, made up of coalition members. Each committee has a volunteer member co-chairs and a staff lead, along with participants from across the state, all working in the same domain. Thirdly, in addition to being guided by the cancer plan and by task force decisions, we also work towards our goals with the help of amazing volunteers just like you. A little bit about the Nevada Cancer Plan. The current Nevada Cancer Plan has 5 goal areas covering prevention, early detection, equitable access to care, survivorship, and quality of life, and cancer data and clinical trials. Within each goal area are measurable objectives, such as increase the percentage of adults who are former smokers, increase the percentage of adults screened for breast, cervical, colorectal, and lung cancers, or increase healthcare workforce capacity to address cancer. Each objective then includes a list of strategies that could be used to help achieve the objective. These strategies are sort of a tactical guide partners can use to reduce the cancer burden and improve outcomes in Nevada. Each year, the progress on this plan is evaluated by our partners at the state and with the help of our members who share details on strategies they're implementing. This evaluation helps us not only to reevaluate our focus each year and guide our task forces and collaboratives, but helps us to set direction when developing the next plan. We highly encourage you to review the plan linked on our website and identify areas where you may already be working and others where you may be able to implement strategies to move the needle on our cancer control. As you can see here, this is our organizational chart. We are a small but mighty team of 8. We have our elected board of directors that help with guiding our goals and decisions, in addition to reviewing our work. We have our executive director, Carrie Harrington, who supervises and leads our organization. We have Michelle Lambert, our operations manager, who manages the day-to-day operations of our organization and operates all of the financials. We have myself, Sarah Gocki, as the community engagement manager. I oversee our outreach and volunteer efforts. We have Amy Thompson, our survivorship programs manager, who is in charge of our survivorship and navigation network. We have Lily Helzer, our prevention and early detection programs manager, who oversees all of our programmatic initiatives. We have Val Martinez and George Arambula, who are both cancer outreach coordinators and certified health workers. They are based in Las Vegas, and they coordinate outreach efforts in Las Vegas in addition to being navigators for cancer survivors. And then last but certainly not least, we have Kristen Hackbarth, our communications director, who oversees all of our media and communications efforts. We are a tiny but mighty team of only 8, and as the coalition grows, we need the help of volunteers to make this important work happen. Some of the roles that we need volunteers to fill are outreach and education, policy and advocacy, event planning and fundraising, SunSmart advocacy, clerical and administrative tasks, and sharing your story. We will do a deeper dive into each of these on the next few slides. When assessing which role would be the best fit for you, think about the skills and expertise that you have in addition to what you are most passionate about. Education is one of our biggest volunteer opportunities that we offer here at NCC. We attend partner outreach events like health fairs, pride festivals, Reno Aces games, 5K events, and we even host our own events like the White Ribbon Project, which is the Lung Cancer Awareness Party, and Paint Nevada Pink events, which is our branding for all breast cancer events we host in October. And we are always needing assistance with these outreach events. At these events, we need help with exhibit space setup and teardown, which includes setting up the table and putting the outreach materials on the table, sometimes helping to set up a tent, and sometimes assisting with blowing up our large inflatable lungs or colon. And then we need assistance with teardown after the event. At these events, you will be engaging with community members, sharing health resources like brochures and flyers, and educating on best practices for prevention and early detection of cancers. What it boils down to is this is the community-facing side of the volunteer work that we offer. So how do you know if you will be a good fit for outreach and education? Are you friendly and compassionate? In this role, you will be talking to community members, sharing resources and information around cancer, and often you will hear stories about people experiencing cancer in their own lives or the lives of their loved ones. It's important to empathize with them. You want to make sure that they are heard and that you offer any and all resources that might help them in their own lives. Do you have a desire to interact with underserved and sometimes vulnerable populations? These communities can include, but are not limited to, low-income communities that need resources, rural populations, indigenous populations, cancer survivor groups, Black, Hispanic, Asian populations, and LGBTQ+ populations, just to name a few. Do you believe in equitable access to healthcare? That all Nevadans should be able to receive the healthcare and resources that they need to be the healthiest versions of themselves, regardless of economic status, gender identity, sexual orientation, or race? And lastly, do you believe in treating others the way you would want to be treated? If so, our outreach and education volunteer opportunities would be a great fit for you. On this slide, we will be touching on recommended cancer prevention measures. As a volunteer, you will want to be familiar with recommending these to people that stop by the table. Tobacco is the #1 preventable cause of cancer, specifically lung cancer. We have resources available at each outreach event, like the Nevada Quit Line, to assist people if they need help quitting tobacco. The leading cause of skin cancer is ultraviolet UV radiation. We always recommend to protect your skin from UVA and UVB rays, including use of sunscreen, seeking shade, and wearing protective clothing. To prevent against 6 HPV-related cancers, we recommend the use of the HPV vaccine. And lastly, a healthy diet and weight might lower the risk of some types of cancers, so encouraging healthy food habits and exercise habits will play a part in educating on cancer prevention. As an outreach volunteer, you will also want to be comfortable with knowing the recommended cancer screening protocols. It's important to note that the recommended ages for cancer screenings might vary based on genetics and family history. So we always recommend people to talk with their doctor to learn about their own personal risks for cancer and to see if the doctor recommends earlier screening ages based on those factors previously mentioned. These are the recommended screening ages. For breast screening, it's recommended every year starting at age 40. For cervical screening for ages 21 to 29, a Pap test is recommended every 3 years, and for ages 30 and up, a Pap test plus the HPV test is recommended every 5 years. For colorectal screening for age 45 and up, a colonoscopy is recommended every 10 years or a stool test every 1 to 3 years. For lung screening for age 50 and up, a CT scan is recommended for current or past smokers. For prostate screening, it's recommended for age 40 and up to talk with your doctor about the PSA test. For skin screening, it's recommended to know your skin and to do regular self-skin checks. If you notice any variations or abnormalities in your skin, you'll want to see a dermatologist to have it examined. And as always, if you don't know the answer to something, you can always say, I don't have the information on that, but I can direct you to the NCC member in charge who can better answer your questions. It's always better to say that you don't know something than to give incorrect information. Policy and advocacy work is a huge part of what we do here at NCC. This is the opportunity to help on a macro level within the state of Nevada. One of the most recent examples of this work was our work on Senate Bill 330, which expanded access to breast cancer imaging, requiring commercial health insurers to cover annual mammograms, supplemental and diagnostic imaging exams at no cost to the patient. This is just one recent example of some of the exciting policy work that we have advocated for, and there's more policy and advocacy work to come in the future. As a volunteer, if you have any expertise in the field that we are drafting policy on, we could use your expertise not just in drafting the policy, but also to testify and be a spokesperson for the bill. If you are interested in this, please reach out to see what you can. There will be plenty of opportunities to help us with event planning and fundraising on some of our bigger projects and events. Some of these bigger events include Nevada Cancer Control Summit, our annual cancer summit that we host every year that usually occurs in late August or September. Paint Nevada Pink, our breast cancer awareness events that occur in October. The White Ribbon Project, our lung cancer awareness event in November. Colorectal cancer awareness events in March. Skin check clinics that are usually in May during Skin Cancer Awareness Month. And lastly, the 2 major Pride festivals, one in Reno and one in Las Vegas. These opportunities will be on an as-needed basis, and opportunities will be posted within the volunteer portal. Do you enjoy working with kids and teaching? Our SunSmart program might be the right fit for you. SunSmart is the program that we have that educates all Nevadans, but more specifically youth, on the risks of skin cancer and how to implement sun safety protocols. We have presentation materials that you can take to schools to educate these youth on sun safety. Within this program, we also partner with the UNR and UNLV School of Medicine to host skin check clinics. We will also bring out our sunscreen dispensers to various events like 5K runs and festivals, just to name a few. It's important to note that if you are interested in giving SunSmart presentations, additional training will be required. Please reach out to me. My email email is listed on this slide if you are interested in additional training to volunteer within our SunSmart program. If your talents lie more within the clerical and administrative realm, and you want to volunteer more behind the scenes, there will be opportunities to volunteer at our corporate office in Reno. Tasks might include putting together resource packets, mailing correspondence to NCC members and partners, and data entry tasks as needed. These tasks are on an as-needed basis, and opportunities will be published in our volunteer portal. If cancer has impacted you in some way and you would like to share your story, we will have opportunities for you to share your story. Different ways that we could use your story for the greater good include featuring your story on social media and media campaigns, having you tell your story at NCC events and webinars, featuring you in a blog post or the option to write your own guest blog post, and lastly, using your experience to sign on or advocate for cancer control policies or to educate lawmakers. These opportunities will be on an as-needed basis, but we will let you know about these opportunities via the volunteer portal. There are many ways in which to get involved with NCC, including the many collaboratives. We call them by this name rather than committees because we want members to know that these are active, participatory groups with everyone working together, not passive meetings. Collaboratives are led by chairs or co-chairs who are coalition members and have the support of an NCC staff member. Each group selects the goals from the cancer plan, also developed by members. On the next page, you'll find a list of NCC's current groups and associated staff leadership. Collaboratives include HPV prevention, led by NCC staff member Lily, colorectal cancer, led by George, lung cancer collaborative, led by Lily, breast cancer collaborative, led by Lily, survivorship collaborative, led by Amy, navigation network collaborative, led by Val, and lastly, the surveillance and planning collaborative, led by executive director Carrie. If you are interested in joining any of these collaboratives, please reach out so that we can get you in on the list to be included in meeting invites. So you're a volunteer, now what? There are so many ways to get involved with volunteering at NCC, but the number one way to find volunteer opportunities is through our volunteer portal. As you are filling out the volunteer application on our website, there is a section on the application for you to input your volunteer portal logins. Make sure to save these logins so that after you are approved as a volunteer, you log into the volunteer portal to sign up for volunteer opportunities. You won't be able to log into the portal right away. You'll have to wait until your application is approved, which should happen within 2 business days. Once you are approved, you can log into the volunteer portal and start signing up for events. The volunteer portal can be found on our website under the main menu, select Connect, drop-down menu, and select the Volunteer tab. There will be a link for the Volunteer tab found here. Click the link and it will take you to the Volunteer portal login screen. You will input your volunteer portal logins, the same logins that you used to input on the application form. Once you log in, it will take you to the volunteer portal home screen. This is your main menu within the volunteer portal and will include any news or highlights from volunteer work. Next, if you look at the menu bar, you can find the Mail tab, which is where you can view any messages sent from NCC about upcoming volunteer opportunities. Next tab is the Schedule tab, which allows you to view the schedule for any volunteer opportunities that we need volunteers for. You can click on upcoming events within the calendar to sign up as a volunteer for that event. The Service tab tracks the hours that you have volunteered with us. This will update automatically when you log in at the volunteer event. We will have a QR code for you to scan, so it makes it a seamless and automated process for tracking down volunteer hours. However, if for whatever reason you are unable to sign in via the QR code at the volunteer event, You can manually input your service here as well. Lastly, in the volunteer portal, if you wish to change or update anything in your profile, like your address, birthday, skills and experience, emergency contact, or add a profile photo, or update your account settings, like opting in and out for text messaging and changing your password, you can do all of that by selecting the drop-down menu on the top right of the screen and either selecting the Profile or Account tab. As you can see, it's a straightforward and user-friendly volunteer portal. If you have any questions regarding the volunteer portal, always feel free to reach out to me, Sarah, at nevadacancercoalition.org. There is also a volunteer portal app called VicNet, which you can download from your app store. Some perks of being a volunteer include building your community service resume, attending fun and meaningful events in the community, networking opportunities with other organizations and healthcare professionals, developing new skills, being a part of something greater, and really impacting your community through cancer education and awareness, representing a respected statewide coalition, helping to guide cancer control efforts in the state, and lastly, volunteers will be celebrated and appreciated throughout the year through highlights in our newsletters and through in-person volunteer appreciation events. If you want to learn more about our organization, we encourage you to check out our website. From our main menu, you can find tons of resources, including the Cancer Plan, our different programs and collaboratives under our Collaborative tab. Under the Connect tab, you'll find our events calendar that includes all upcoming NCC meetings along with partner events and webinars. You can submit activities to the calendar by sharing details with your NCC staff contact. You will also find the link to log into the volunteer portal on this tab. The About tab has general information on who we are as an organization and what we do. Please explore the website to learn more about us. We also send emails out on a regular basis. Each month you'll get NCC's monthly newsletter filled with volunteer highlights, tools, the latest news in cancer control and NCC activities, and news provided by partners. If you're on a collaborative, you'll receive emails from each of those groups, as well with information on recent and upcoming meetings and activities. And as always, please reach out. We are here for you. Our emails are just our first name at nevadacancercoalition.org. As the Community Engagement Manager, I'll be your main point of contact for any volunteer work, so feel free to reach out to me anytime. And that concludes our new volunteer orientation. Thank you for attending today. We look forward to seeing you at our upcoming events. If you have any additional questions, please don't hesitate to reach out to me. My email is sarah@nevadacancercoalition.org and my phone number is 775-451-1670, extension 104. Thank you.